The Spatz3 adjustable balloon system offers an easily adjustable one-year balloon therapy that provides a safe, customized balloon weight loss system, now easier and faster for endoscopists. The insertion kit contains the device connected to the extension tube with the provided cap, the insertion facilitator, and the syringe. Prior to implantation, a standard endoscopy is performed to evaluate for contraindications. After completing the endoscopy, dry the endoscope thoroughly. You may prefer to remove your gloves. Tap the insertion facilitator onto the end of the endoscope and secure it by pulling both holes over the endoscope. Fold and double back the insertion facilitator. Firmly pull up the proximal end to form a pocket and insert the end of the balloon 5 mm into the pocket. Fold back the insertion facilitator over the balloon. The proximal edge of the insertion facilitator should land between 3/4 of the way between the first and second bands, or just touching the second band. Adjust accordingly. Hold the endoscope and device in one hand and generously lubricate the balloon, endoscope, and valve areas, as well as inside the mouth guard. Insert the endoscope and device as you would in a normal endoscopy. A snug fit at the mouth guard and the upper sphincter are to be expected. Pass to the distal antrum. Retroflex to confirm presence of the balloon in the stomach. If the balloon fell off in the esophagus, you will need to push it down below the GE junction. Attach the three-way stopcock to the saline bag and the syringe. Inject 500 cc of fluid. The balloon will fill and release itself from the endoscope. Pull the endoscope back to confirm release of the balloon. A completely filled balloon will have no creases and will have a thick cap. Once fully inflated, the balloon can be inflated further or deflated to the desired final volume. We recommend 550 to 600 cc as a starting point, since it can be adjusted upward at a later date. The endoscope is pulled back to the esophagus alongside the white catheter. The endoscope and extension tube can be removed together until the valve exits the mouth. Or, the endoscope may be left in the mid-esophagus while pulling out the extension tube alone. The valve is secured by the assistant while the extension tube is disconnected and replaced with the white cap. Lower the valve into the back of the throat. Reinsert the endoscope and gently push the white cap and white catheter below the GE junction. The procedure is now complete. Adjustment procedure. The balloon volume may be increased or decreased multiple times after the initial implantation. Endoscopy is performed. The easy grasp valve is captured. The endoscope is removed with the valve pulled to the tip of the endoscope. The cap is twisted off and the valve is connected to the extension tube. Do not lose the cap. The extension tube is lowered into the throat until there is no further pulling on the tube. Inflate or deflate as desired. The extension tube is pulled out until the valve exits the mouth. The extension tube is disconnected and replaced with the white cap. Lower the valve into the back of the throat. Reinsert the endoscope and gently push the white cap and white catheter below the GE junction. The procedure is now complete. Extraction procedure. The balloon may be deflated with a gastric balloon needle catheter. Puncture the balloon with the needle. Deflate fully. Grasp the distal balloon with the balloon grasping forceps. Pull to the tip of the endoscope. Torque and rotate as you remove the balloon. Or you can use a large snare. Again, pull to the tip of the endoscope. Again, torque and rotate as you remove the balloon. Or you may choose to deflate the balloon via the inflation valve. The easy grasp valve is captured. The endoscope is removed with the valve pulled to the tip of the endoscope. The cap is twisted off and the valve is connected to the extension tube. The extension tube is lowered into the throat until there is no further pulling on the tube. Deflate completely manually or by connecting to the suction apparatus. Reinsert the endoscope to confirm complete deflation. Grasp the Easy Extract loop and pull it to the tip of the endoscope. Remove the endoscope and extension tube together as one unit. Pull the deflated device out of the mouth. The procedure is now complete. The Spatz3 adjustable balloon system offers the first adjustable one-year balloon for weight loss, which yields better patient comfort and longer-term weight loss. Its unique insertion procedure provides doctors with a safer means to implant the balloon under the direct guidance of the endoscope. During the year, the balloon can be adjusted multiple times, thereby achieving a customized fit with greater weight loss. The Spatz3 balloon provides endoscopists with the ability to tailor the balloon volume to exactly suit the requirements of the individual patient over the one-year treatment period. Used in harmony with a professionally supervised program of behavior modification and diet, it can help achieve and maintain the health and aesthetic benefits associated with weight loss.